Hello, I'm Dr. Charles Gardner, Medical Officer of Health with the Simcoe Muskoka District Health Unit, here to provide the COVID-19 update for Simcoe Muskoka. So at this point, we have 733 cases in total, which is up by 20 cases since the last time I reported on September the 1st. There are 17 new cases today that have happened over the long weekend. Of these, 8 are male and 9 are female. They range in ages from under 10 to in their 80s. And it's a very young population. The mean age of this group is quite young. We've got 71% that are under the age of 35. 12 out of the 17 are under the age of 35. We've got 16 of them in Simcoe County and 1 in Muskoka. 15 of those are sporadic cases. 1 is part of an institutional outbreak, and 1 is part of a workplace outbreak. We have 7 of them being from close contacts with other known cases. 4 are under investigation. 3 of them are travel related. 1 is acquired in the community, 1 is part of the institutional outbreak, and 1 is part of the workplace outbreak. 14 of these are presently at home on self-isolation. 1 is hospitalized in South Lake, female between the ages of 18 and 34, and 1 is in an institution, one of the long-term care facilities, as part of the outbreak. So if we look at our cases more recently, we'll see that indeed we're continuing to go up over time. If you look at the most recent week, beginning with August the 23rd, we had a total of 22 cases. This is up from the previous week, August the 16th, where we had 11 cases. And the week before that, August the 9th, we had 4 cases. So definitely seeing an upward swing in our cases at this time, which is, I think, cause for some concern for us all. Reminds us of the importance of maintaining our control measures, of maintaining physical distancing from other people who are outside of your immediate social circle of 10 people, the same 10 people sticking together as the same group. So other people, you need to be 2 meters distanced. You need to be using a face covering when you're in indoor public spaces, or if you're in other places where you cannot physically distance from people, you need to be doing hand sanitation, self-monitoring if you develop any symptoms, self-isolation, and seeking assessment and testing. So we have to keep up all of those things. This upward trend is worrisome and an indication, a reminder to us that we can't let all those things go. If we let them go, it'll continue to grow and could potentially become the second wave that we are all concerned about. We do know that rates are much higher across the border in the neighboring states in the United States. There can be in the range of 1,000 cases a day in states such as Ohio or Michigan, in the range of 800 a day in New York State. These are states that have similar population sizes to Ontario. So Ontario right now is having an increase in cases as well. Approaching 200 cases a day, and certainly that's noteworthy considering that through much of the summer we were under 100 cases a day. So Simcoe Muskoka is experiencing an increase, as is the province, very much in the Greater Toronto area and in Ottawa. We have three outbreaks in Simcoe Muskoka. 2 of them are long-term care facilities. So one is the Pines in Bracebridge with 1 staff case and 1 resident case. We have an outbreak in Roberta Place, which is a long-term care facility in Barrie, with 1 staff case, but no residents. And we have a new workplace-related outbreak in a food service facility in the district of Muskoka, affecting 2 of their staff. No exposures were noted with regards to the patrons of these establishments, of this establishment, and the staff that are involved are on home isolation at this time, and others are presently working at that facility, people who were unrelated to the outbreak, and the facility had undergone a deep cleaning. We had an outbreak at Mill Creek Care long-term care facility in Barrie, which has been declared over as of September the 5th. And that only had 1 staff member. We've had a total of 90% of our cases recover, 665 recoveries. We have at present 2 hospitalizations with nobody in the intensive care unit. Currently have 23 individuals who are self-isolating at their home, and 3 are in isolation precautions related to long-term care facility outbreaks. So there are no new deaths, a total of 37 deaths. And if we look at our trajectory of cases over time, we see that our rate has gone up. So we have a rate in the past week of 3.7 cases per 100,000 population, compared with 2.4 per 100,000 population a week ago. And our reproductive number, which is an indication of whether the pandemic is growing in our area or decreasing, is 1.05. Which indicates that it's growing. If it's above 1, then it's definitely growing. With regards to the outbreaks at the Pines, as I'd indicated, we have 1 staff member and 1 resident who are cases, and we've obtained testing on all of the other residents and found it to be negative, and have obtained testing from most of the staff. There's test results remaining on the rest of the staff, but so far the test results have all come back negative, so that's certainly a very good thing, and we're maintaining all of our control measures at that site. With regards to Roberta Place, as I'd indicated, we have 1 staff member who's a case, and we are presently testing all of the individuals at the site, both the staff and the residents, and are awaiting results. I've already spoken to the workplace in Muskoka, the food services establishment, and the measures that have been taken to date. Okay, a few key messages today. Today, schools begin throughout the province, throughout Simcoe, Muskoka, and we've done a great deal of work to get ready for this, as have the schools and the school boards, and no doubt parents as well. What's really key right now for parents is to screen your children each day before they go to school to make sure that they don't have any symptoms or signs of COVID-19, and if they do develop any symptoms, that they are to be excluded from school, and that you would be then seeking medical advice, assessment on what to do next. So there is a screening tool that the province makes available, and we have on our website as well, a screening tool for people to use that provides you with the details about what you should be looking for in the way of a presentation for COVID-19. And even if you have just one finding, one symptom, that's enough to stay home. We do note the following with regards to children being able to return to school. First off, we've indicated that if they have symptoms that are consistent with COVID-19 persisting for more than a few hours, that are not new or not related to seasonal allergies or pre-existing medical conditions, that they should stay home. So there's certainly children that will have allergies and it's an established condition for them. So we're not talking about that. We're talking about something that's new. Same with teachers. With regards to returning to school, with people, students and teachers who have symptoms that preclude them from going to school, and then they get an assessment, and if they end up with a test being done, if that's recommended by their practitioner, their family physician, and that result comes back negative, they can return to school 24 hours after their symptoms have stopped, provided that they haven't been a contact of a case. Now, that if somebody has symptoms and they're a contact of a case, then we're following them as a public health unit. And in those instances, they stay off for a full 14 days in order to make sure that they're not transmissible with COVID-19. And that's the case even if they have a negative test. It's a precautionary measure to protect the school environment. Students, teachers can return to school if their healthcare practitioner makes a diagnosis that is not COVID-19. They have another explanation for what's happening. There is no requirement by the province that a medical note be provided when they return to school. It would be an attestation from the parent that the symptoms have been dealt with a primary care practitioner. So we have some questions here about what will happen if a student develops symptoms at school. If they show any symptoms of COVID-19, their teacher would identify this and they would be carefully put aside in a safe room. People involved wearing personal protective equipment and keeping a 2-meter distance, and their parents would be called in order to pick them up and then have them taken home and for follow-up and assessment. If a student tests positive related to COVID-19, then we conduct an assessment in order to determine whether or not there'd been any exposures at school, whether or not they'd been at school while they were contagious, which can be up to 48 hours before the onset of their symptoms. And if that's the case, then we would be assessing who had they been in contact with. They're to be in cohorts, classes, and so we'd be looking at their class. And if they were traveling on a school bus, we'd be looking at that group as well. The schools keep records of attendance for everybody involved so that it'd make it easy for us to follow up to identify who needs to be excluded for a 14-day period, recommended for testing if they develop symptoms, certainly to be tested, and for us to then follow up with there for anybody who would be positive. Anyway, another, I think, important point for us, given that we have an increase in our cases, is that we have to keep up our measures. So I've spoken to this earlier. It's up to us to keep the control measures in place to avoid a second wave of COVID-19. We have had now 3 small surges in COVID-19 since June. The others have come back down again. If we work hard at it, we'll bring this one down as well. If we're not careful, this will keep going up. So it's up to us to maintain this control. And we've seen in the past that many of our cases have been related to family gatherings. And so you need to be careful about family gatherings and stick to your social circle of 10 people. If you have other family members beyond that social circle, then you can see them, but you have to maintain your distance of 2 meters from them in order to protect them. And I think it's important that people be mindful of who's vulnerable. Now that children are heading to school, that's another opportunity potentially for transmission. And now that we're getting more cases, some of them work-related, we have to think about our own social circle and protecting our social circle and identifying who's particularly at risk in our social circle. Are there people with existing medical conditions or older people? And it's always worth evaluating if you need to take additional precautions with those people. If you need to physically distance with those people, if they're better off perhaps in another social circle that doesn't have that exposure through say children at school or young people at work. University students returning to university, it's always worth reevaluating that, or reevaluating if they're in your circle, do you keep more of a distance with them, take more precautions with them. I think the work environment's a really key thing. Transmission can happen at work, has happened at work. Employers need to have their employees self-screening for symptoms. An additional precaution is employers to screen for symptoms and exclude employees who have symptoms. Also to maintain physical distancing of 2 meters, if at all possible. And if that isn't possible, to be using masks. So I've given direction that people are to use masks in indoor public spaces, but there are work-related spaces that aren't public, and those can be places where transmission happens. And it's really up to the employer to have a policy requiring mask use, face covering use in those settings as well. And also to promote hand hygiene, hand washing, make available hand sanitation is a really critical thing. And as I said at the very beginning, really important that people are being screened before they come to work. We've had questions about the flu vaccine this year and the importance of managing influenza. So later in the fall, October, from then through to April, will be influenza season. And every year we promoted the influenza vaccine as a way of reducing your risk of getting and transmitting influenza. And this is a year in which we want as little influenza as possible to avoid confusion with COVID-19. Anyone who gets influenza this year, the immediate question would be, are these symptoms influenza or is it COVID-19? And we would have to sort that out. And influenza is a serious infection in and of itself. It can certainly cause very significant illness, including hospitalization and including death, particularly for people with pre-existing medical conditions and older people. Influenza can also cause serious illness in the very young. In that regard, it's different from COVID-19, which is less harmful to young people. So the flu vaccine is a very good idea. That will certainly be promoted this year. It will be coming, as it always does, for vulnerable groups, October, and then general population from November onward. My understanding is the province is ordering more flu vaccine than usual because they expect a bigger uptake. The experience in the southern hemisphere during their winter was a bigger uptake of influenza vaccine. There's also a marked drop in influenza illness in Australia and other places in the southern hemisphere this year, which may very well have been related to the control measures that they were following for COVID-19. So if we're very fortunate, we'll get that additional benefit from our own control measures here for COVID-19, possibly a reduction in influenza, which would be a very good thing. But certainly getting the flu shot is an important part of preventing influenza transmission. So at this point, I'd be happy to take questions.
Thank you, Dr. Gardner. We're going to start with James Bowler from Your TV.
Thank you very much, and thank you, Dr. Gardner, as always, for providing these updates. My first question has to do with this food service, as you're calling it, outbreak. And just a quick comparison to sort of tee up my question. You know, in situations where there's a hepatitis outbreak or something like that, usually that gets reported by the health unit on where that is. Now, when it comes to COVID, these are tightened up for some reason, and I'm just curious, you know, why are we not finding out where this outbreak is? I understand there's a level of protection that needs to happen for the people that are infected, but at the same time, I think there's a level of information that needs to be given to the public as well.
Yeah, so very good question. We always provide information to protect the public when we feel that we cannot identify everybody who is at risk, to approach them directly ourselves. And so with hepatitis A, for people that have, that's a good example where people have eaten at a certain establishment. They don't have a record of everybody who attended the restaurant on those dates, and so we wouldn't be able to get to people directly to tell them that they would benefit from a vaccine. In that instance, with hepatitis A, there's an intervention to be pursued. We wouldn't be able to do that, and so we use the media in order to reach them. Otherwise, we're seeking to minimize harm, and that includes harm to individuals with privacy, but also harm to businesses as well. We release the name of a business if it's necessary to protect the public. So in this instance, the control measures that were required, the use of face coverings by employees, was in place. And so the exposures of concern were actually with staff away from the clients. We know who the staff are, and they've been approached directly by us.
Thank you for that. And I just have a quick follow-up, different question. Earlier today, during his daily briefing, the Premier made a comment about a camp in Muskoka, which had been visited by the OPP and was hosting international visitors. And the Premier also said that this had led to a COVID infection. So I'm just wondering, first of all, if you can comment on the situation, if you have any information more to provide on what had happened here.
Okay, so there was no COVID infection to date related to that situation. And in that situation, we had a number of individuals that were in quarantine, having returned from travel out of country. And there was some contact between those that were in quarantine and others at the camp that were not. And so for that reason, we've been working closely with the people involved in order to safely have them return home to continue isolation, to ensure that there isn't transmission related to this. But there have actually been no cases related to this as yet.
Thank you for that confirmation. Appreciate that.
You're welcome.
All right, thank you, James. We're going to move on to Elizabeth Smith from Rogers.
Yes, thank you. Hi, Dr. Gardner.
Hello.
My question is kind of what you mentioned right off the top. I'm just wondering, the numbers are going up locally as well as throughout the province. So are we technically still in the first wave, or is this signs of a second wave? I guess, could you clarify what a second wave is?
So there is no definitive definition of a second wave. The idea is a return of cases in a magnitude that would be similar to the first wave after the first wave is over, after it's completely come down to a very low level. And so I don't have that kind of a specific definition for you, I'm afraid. I would say that we're seeing an upsurge right now. If it were to continue and be comparable in size to the first wave that we had in the spring, then I would call that a second wave. I'd say right now, I'm considering us on alert for the potential for that, and I'm calling upon everybody to abide by the control measures to bring it back down under control so that we don't get a full-fledged second wave.
Okay, thank you for that.
You're welcome.
Any follow-up, Elizabeth?
No, that's everything today. Thank you.
All right, thank you. Ian McLennan, Barrie 360.
Actually, Ian's off today, but I'll ask a question if that's okay.
Oh, okay.
All right, thank you. Good afternoon, Dr. Gardner.
Good
I'm just
afternoon.
wondering, some of our reporters were out and about at area schools this morning, including at Bear Creek Secondary. We got a picture of a large cluster of students outside. Now, many of them were wearing masks, but few were following physical distancing guidelines. Do you think this is a cause for concern, and how could educators or even parents address this after that?
Well, we do want everybody abiding by physical distancing, and I've been saying that I've seen instances in my own walks about my neighborhood of people who tend to be younger, congregating in larger groups close to each other, that could very well be or lead to transmission. So gathering in front of schools like that has the potential to lead to it as well. It's a greater risk if done indoors than outdoors. Within the school environment, the classes are to be managed so that you have cohorts, so that you've got a separation of people, youth, into their classes and not mixing with other classes. That is meant to help contain any infections that happen, contain them to one class, not the whole school. And physical distancing is to be promoted as much as feasible, possible. But I think you raise an important point that's worthwhile for us to pursue. What can schools do with regards to the encouragement of physical distancing outdoors as well? I'm sure it'll be a challenge for them, and a part of it's going to have to be messaging to everybody, to the youth, to the students, about the importance of keeping this up at all times and not just within the school or within classes. I thank you for that. I think that's a worthy thing for us to look further into.
Follow-up, Brett?
Yes, please. And that said, Doctor, I'm just curious, do you think that maybe a lot of these younger people are getting that COVID fatigue? They've heard this message over and over and over again, and now it's a message that they may be choosing to ignore.
I think it's something that we're all vulnerable to at this time. It's not, what we're asking of people is not natural of people, that they limit their social contact with other people, and that they maintain a distance from people. That's not natural for us. We naturally come close to each other to talk with each other and want lots of friends and social interaction. And so this is limiting to the quality of our lives. And we are seeing some increase now in transmission. We are seeing an increase in the number of contacts with each one of our cases. So before we had maybe 3 contacts per case in the past, a month or so before, but now we're seeing in the range of 7 contacts per case. That's an indication that people are increasing their social circle, their interaction with people, that they're getting fatigued with abiding by the message that we're giving. So it's just part of the challenge of it all for us.
All right, thank you for your time.
You're welcome.
Thank you, Brent. We'll move on to Don Huddlestone from the Huntsville Doppler.
Thank you. My question's been answered already.
All right. Is there anyone else on the line who we have missed?
Chris Simon from the Advance.
Chris
No.
Simon, you go ahead, please.
Thank you very much. Hi, Dr. Gardner.
No.
Just wondering if, at this point, the health unit has any idea in terms of what a baseline for infections might be before we start to clamp down again, and maybe look to close schools, look to shut down businesses, what we did at the beginning of the first wave.
I've raised this at the province. I'm on this public health measures table at the province, and raised the importance of knowing the metrics being applied, looking at the metrics on a regular basis. I know that at least one other health unit has internalized that. They have that as a set of indicators for themselves that they're using. We at Simcoe Muskoka are developing our own dashboard about how we would interpret the rates, and at what point we would become very concerned. I'm concerned with any increase. I'm concerned right now with the increase that we're having, but it's true that we don't actually have an alert system with a level that would indicate formally a degree of alert, like a color system. We don't have that. I at this point have been limiting myself to giving messages to the public rather than seeking to put in place some other measure of some kind. And I think it would be challenging for a single health unit to do that on their own. I think it would be much easier if we were to do it together or with provincial direction. Certainly it's not an easy thing to say unilaterally in one health unit, say, well, here you can no longer have gatherings beyond 10 people. You know, the province is saying 100 outdoors, but we're saying 10. It would be extremely hard to do that locally. If it were absolutely essential, we would certainly look at it, but it would be far, far easier if we do it together as a province.
Today, obviously, as you've alluded to already, we've had one of the biggest jumps in a while here. Do you suspect there's a reason why? Is it simply down to people going outside of their social bubbles, as you've discussed previously, or is there anything to why we may be seeing an upswing in cases?
So the majority of it has been clusters in families. So I think it's, if you had to pin it on one thing, it's people broadening out their social circle, including more people in their family. There's been some interplay between that and work. Like, there can be an instance of somebody that gets it from the family and then gives it to a coworker, or vice versa. It can go the other way. So family gatherings, work environments. We still occasionally get some travel related. So one thing I forgot to mention today is that 3 of our cases over the last weekend were travel related. So that's still another potential source. But if I had to warn people about 2 things, it would be family gatherings, like the social gatherings, and the need to maintain the 10 and not go beyond that, and caution at work. And there I would particularly point that out to employers, that they need to maintain safety in the workplace.
Thank you.
All right, is there anyone else that we have missed today? All right, I think that's it then. Thank you, Dr. Gardner. Thank you, everyone, for joining us.
Thank you.
Thank you. Goodbye.
Take care.